One of Australia's leading infectious diseases experts says Victoria needs to enter stage 4 lockdown now before it's too late.
Professor Nigel McMillan warns the state could continue to see between 200 to 4,000 new cases a day until the end of this year, saying what the state government is doing now isn't working. He joins us now from Logan in Queensland. Good morning to you. Victorian authorities are hoping we've zeroed in on the peak. Why don't you think we're at that yet?
When you actually look at the data, while the peak is determined, I guess, by the R0 number, which is this replication figure that the Health Minister was talking about yesterday, if you look at the raw numbers, those numbers are going up and up and up. And you're on now week 3, I guess, of the lockdown in Victoria, and we would expect to have seen changes, more significant changes by now. I would love for that peak to drop down, and I would love Victoria to get back to 0 cases. It would be fantastic. But whatever they're doing right now is not working.
But hasn't there been modelling which has suggested that we are now at the peak? Numbers are high, but they're not doubling every couple of days.
They're certainly not doubling. What we want to avoid, I guess, is getting to that situation where you see in a number of other countries where it's just limping along at that same level week after week, month after month, where because people aren't, I guess, perhaps behaving in the way that we would want to, and the measures that are taken in stage 3 aren't quite as effective, you essentially hold things at bay without actually getting those numbers down.
Right.
Look, I'd love to be wrong. I think that the numbers going down would be fantastic.
You don't buy it at this point. Well, the transmissions, I reckon, inside the hospitals and the aged care facilities, they knew it was coming, is a real concern. Surely that should have been sorted before now. And what possible explanation do you have for that?
Yeah, look, I think if the aged care homes didn't know this was coming, I don't know where they've been in terms of their PPE and controls. I mean, the aged care sector is the last place that we want to have this particular virus, and we will see deaths coming out of this for sure. In hospitals, this is obviously unfortunate. We've seen all over the world healthcare workers being infected. They put themselves in the line of danger for us every day, and we don't want to see those sorts of infections at all. This is just emphasises why we need treatments and we need a vaccine as soon as possible.
Say Victoria does stay in stage 3 lockdowns and doesn't move to stage 4, what do you think the numbers will do?
Look, you know, I think they're just going to go along between that sort of 300 and 400, maybe a bit higher, just continuing on till, you know, the end of the year. I'm calling for stage 4, which is essentially a strict stay-at-home order and the closure of, you know, all businesses except what is essential businesses and education facilities. This is what New Zealand did. We know it works. And of course, we all want to get to that sort of suppression near to 0, which is what the other states have achieved.
Nigel, thank you for your time today. Appreciate it.